for our patients, for our families, for our profession, and we will not back down. She is basically trying to get rid of a lot of workers, and she is not friendly to workers in general. And registered nurses in our profession, it is important that we remain at the bedside. And our concern is that with all the reform, the business model that she's bringing to California, that we will be affected and our patients will be affected, more importantly our patients. And we are patient advocates, and we are on the street to let her know that you cannot mess with our patients, because when you mess with our nurses, you mess with the patient, and as patient advocates, that's why we're here. She wants to deregulate, she wants the hospital industry to have a free reign. We're not going to have that. They're not going to have a free reign. We worked very hard to protect and preserve the rights of our patients. We worked for 10 years to do so, and she's going to try to change that. And we do not trust anything that she's saying, because she's just there to get votes. That's all that she's doing. Who does she represent? The business. She is the CEO of eBay. Who does she represent? The stockholders. That's who she represents, not the community, not the patients. So rich, she thinks she can buy it. We still have democracy in the United States. We still have democracy, and we have that in California. And we're here to let her know that democracy will prevail.
Aren't you in the hospitals working? You are mine, all mine. I'm buying you fair and square. Now. Back. Oh, give me the money. Back. Get back.
Sorry,
First, I am going to fire 40,000 state workers that sustain you. Then I am going to do away with the protections that keep you safe, like air quality and patient safety. And next, I'm going to give huge tax breaks to all my corporate pals.
Sweet! Right. Get up. Get up.
Where's that money? Give me the money.
The California firefighters are here to help.
Can you revise?
Is California surviving?
Do you have a pulse?
No
We don't have a pulse.
It's very weak.
It's weak.
Okay. We're absolutely serious about our patients and our patient care and the health of California. We are not going to let Meg Whitman push us around. We're here to push back to defend our state. Meg Whitman is not our friend. She cannot be trusted. She's not going to protect our patients. She's a CEO that's retired with $1.3 billion in her little pension fund, and she wants to cut the pensions of the nurses. No! She also wants to roll back the meal and break regulations, so she's not our friend. Come on, California! California's up for sale! On Meg Whitman!
I've been a nurse for 43 years. I remember the old days when there were no protections for break relief, overtime, etc. I don't want to go back to the sweatshop days. Mandatory 20-hour shifts sometimes, and I work in intensive care, so you can't take care of patients well when you're that tired.
So you're concerned that if she's elected,
That when she talks about deregulating, these are some of the protections she may take away, and I want to hear her speak out on what she is, or what her position really is when she talks about deregulating and taking away some of the things that are holding back business in California.
Are you worried she's going to buy the election?
Yeah, well, she has the money for it, but I don't know if that's going to be. I think that people have enough common sense. I hope that they really see where through to the other side. Her ads are very slick, but they don't convince me.
You think Jerry Brown is a good opponent of hers because he's been rather silent about the issues?
Yeah, I don't know. He has always been ahead of himself, ahead of his time.
So
he's one of the first.
Yes, I do have to go. I have other places to go. Goldman and Sachs and I, we have some inside spins to deal with. I have no time for these peasants, chattering classes. I wish they would just shut up.
See you later.
These chattering classes, I wish they would stop chattering.
She's already, I mean, she doesn't vote? She votes once in her lifetime or whatever, you know. She has no idea. She's clueless. She's on some other planet or something. I don't know, but we're down on the earth and we're in the trenches. She's threatening our livelihoods. Yeah, we're already stretched to the max. We are already, they're stretching us. The ratios are just beyond.
Where do you work at?
We're at
Kaiser Oakland.
Kaiser. And what does that mean to the patients when you're stretched like that?
Oh, we can't.
Well, it affects them. They're the number one victims of that.
Yeah.
We're trying, we're juggling, we're running, we're hurting our backs, this and that. Then they don't,
Yeah, they don't get the quality care that they deserve.
we don't get our vacations, this kind of thing, or they chop us up just to control.
But Kaiser management seems to be making money. They still make
No, don't get us started.
The doctors and
Doctors are always in a different class altogether.
It's really.
want to jeopardize patient safety.
Yeah, they get bonuses if they save money on their units, right?
Wow.
So that's.
people's lives.
Yeah. Oh, yeah.
So the less nurses they use and the less overtime they pay and the less missed lunches and breaks. People are so tired sometimes. You don't even ask for your breaks because then you get counseled. You get counseled if you're a minute late because we're punching in and out these days. I mean, just harassment. Especially for the old timers because we get more money. I mean, we've been there the longest.
and they want you out of there.
Right.
They want to bring in young people.
Right.
With seniority.
Right.
That they can take advantage of.
No, it's really, and that's why I'm out here saying, anybody who threatens my livelihood, anybody, I don't care who it is, on what level, I will stand up against,
Sure. Well, it's a war.
We need unions too because they help us deal with these people who are,
That's right. The problem is, I don't know if Jerry Brown is the answer.
well, it's no Meg. Whatever it is, it's against Meg. Well, like I said, $100 million of whose money? Excuse me, Goldman Sachs. What did I hear? Yeah, right. You ripped us off, lady. And now it's easy to throw it out like that. Why don't you take that $100 million and try and help the poor people, the needy, the seniors, the people that are out of job, whatever, anything but this. You egomaniac.
If Meg Whitman becomes governor, it's not good for working people. They keep saying that they follow state law, but a lot of times they are breaking law, and we're still not able to strike. There was a law that's enacted where on certain floors you can only have a certain number of patients, and it gets broken at UC Davis, and we've tried to work with them as much as possible, but it still gets broken. Sick calls are not replaced, and we don't have enough staff, and a lot of times we are over ratio. And for meals and breaks, a lot of times a nurse, when she goes on meal and break, someone's not really watching her patient. And when a nurse is not able to take a meal and break and they've been working 12 hours, you just can't think on your toes. And these patients are critically sick. You need to be on top of things. It is irresponsible.
What's driving it?
The driving it is money. And when when government gets too close with business is always about profit. And when government gets too close with business, you just get like a BP. Meg Whitman if she becomes governor, she will be our BP. She will cut protections for patients and for workers, and then disaster is going to happen. She has a different reality. When you can spend $93 million on a campaign and it's nothing, you have a different reality. She wants to get rid of of workers' pensions. But she doesn't need a pension. You know, I need a pension because I'm working hard. You know, I can't afford.
So public pensions are under threat. You think she would also continue the attack?
She has verbally said that she is after government public pensions and wants us all to do a 401k where we assume the risk and her friends in the financial industry get profits no matter what. If the stock market goes up or down, you are paying your, your fee, the 1%, 2%. They're going to get it no matter what. You know, we assume the risk.